A glenohumeral joint anterior subluxation is usually going to occur when there is a history of recurrent dislocation and/or subluxation. Mechanism of injury can be abduction, hyperextension, and external rotation. There may be additional issues contributing to the mechanism that allow the humeral head to slip anteriorly, such as a Bankart lesion or a Hill-Sachs lesion. And then we have our baseball pitchers. If we think back to what we've talked about before, when you have a tightening of the posterior capsule in the rotator cuff, this leads to increased scapular protraction, which then leads to scapular dyskinesis. Scapular dyskinesis is defined as excessive protraction and anterior tilting with the glenoid fossa tilting anteriorly. So when you're throwing posterior to the scapular plane, you have an increased strain on the inferior glenohumeral ligament, specifically the anterior band, and then you have attenuation of the inferior glenohumeral ligament and an anterior subluxation. Signs and symptoms include you may be able to see deltoid muscle atrophy. There will be a sensation of a shoulder giving way during overhead movement. With pitchers, the primary complaint is usually pain, not instability. But there will be pain, crepitation, a clicking when the arm shifts back into place. The person can voluntarily reduce an injury by positioning the arm in flexion, adduction, and internal rotation. There may be a dysfunctional overhand throw. When the person sleeps, if they place their hand overhead, it results in apprehension or pain, and combing hair results in apprehension or pain. Range of motion will be within normal limits, except abduction and external rotation will cause pain. Pitchers will also have an increased external rotation with a decreased internal rotation. There are several different special tests that can be performed. The apprehension test consists of the patient lying supine and the arm being placed in that abduction external rotation position. We are simply moving the shoulder through that range of motion and watching for the person's reaction to see whether or not the patient feels like the shoulder is going to sublux from the joint. In addition to the apprehension test, we can also perform the relocation and surprise test. In the relocation test, once the person feels like the shoulder is starting to sublux, as an examiner, you're going to simply relocate that humeral head by pushing down on the humeral head into the joint. And then the surprise test is releasing that humeral head. Normally, pushing down in the relocation test will remove any of that pain and apprehension, whereas the surprise test will bring it back. In the anterior drawer test, the subject is also supine. The examiner is going to place one hand around the humerus below the surgical neck and use the other hand to stabilize the scapula. The patient must remain relaxed while the examiner passively abducts the glenohumeral joint 70 to 80 degrees, forward flexes 0 to 10 degrees, and externally rotates 0 to 10 degrees. While stabilizing the scapula, the examiner is going to glide the head of the humerus anteriorly and apply a slight distraction on the glenohumeral joint. A positive finding is the increased anterior translation of the humeral head relative to the scapula-glenoid fossa. In the load and shift test, the patient sits with no upper trunk stabilization and the involved arm resting on the side. The examiner is going to place an axial load along the shaft of the humerus in an attempt to compress the humeral head into the glenoid fossa. With the load applied, the examiner translates the humeral head anteriorly. If the anterior translation of the humeral head is greater than 25% of the diameter of the humeral head when the load is applied, it's considered a positive finding. During manual muscle testing, if the person has a chronic subluxing shoulder, the rotator cuff and deltoid muscles will be weak. Diagnosis will be through an X-ray. Treatment may start out as conservative with rehabilitation to strengthen those force couples around the shoulder, and surgery may occur later on.